I think this probably is one of the most weighty votes that I've ever had to take in the General Assembly in my 14 years. The next one closest was probably the vote on the death penalty. Um, and I think it has that magnitude because when we're dealing with public health issues and from the testimony, is a death sentence, potentially. I think it's ironic that the bill process seems to sort of reflect what we're doing in this underlying bill. And I say that because it's been rushed. I feel as if it's being jammed down our throats. And similarly, this underlying bill is sort of taking on that flavor. And I don't, as I said in the public hearing process, I don't think we're in a good spot. I don't like what I heard of the medical community refusing to see unvaccinated children in their practices. We are in a bad place in the state of Connecticut in this dialogue, and we shouldn't be here. Because I think you're correct that the vaccination rates are good in Connecticut right now, and we all recognize that there is a trend, and we have to have a discussion about that trend. But we shouldn't be here where doctors are denying children access to medicine on the one hand, and individuals are fearful of seeking medical attention, of speaking their voice, of trying to get a public education. We're in a very bad spot. And I didn't want this public hearing to be on the bill that ended up being before us because I think it only exacerbated the position that we're in right now, and it didn't help it. And I think many of us in this room wants to see this bill change. One concern I have is last year we had a lot of testimony on mandating HPV, and that is a highly personal discussion. And it's based on behavior, whether or not somebody is going to get the HPV vaccine. They may get it when they're 13, they may get it when they're 18, they may get it when they're 25. And I think that's their decision. The construct of this bill would allow for the Department of Public Health to add that to the schedule. And so now you have to make a decision whether to give your child the HPV vaccine or to enroll them in school. And the readings that I've done, my children, we chose not to have that vaccine right now. When they're an adult, they'll make the decision. What's going to happen if this passes into law? I mean, the first thing I'm going to do is file a religious exemption. And it is based on my Catholicism. We are only going to exacerbate now the filings of religious exemptions, and I think the data is not going to become more clear. So I firmly believe this bill is not in the right spot. I think we do need further conversation, but sitting in the minority party right now, I'm uncomfortable because I've tried to make that effort early on in this process, thought maybe we could get here. And I thought I would be in the uncomfortable position of deciding, maybe this is a good bill, I'm going to have to vote for it. And I'm shocked that it never got there for me. This is an easy no vote for me. It should be an easy no vote for everybody. And we need to have a reset on this bill because I have never seen this building the way it is, but I have never seen more raw emotion, more fear, more anger than I've ever seen in my life, and that's not what we signed up for. Thank you.